to the Just for the Health of It podcast. I'm your host, Drew Crawford, here, a public health educator here at Warren County Public Health. And today we're joined by Brandy Richards, team leader with the New York Council on Problem Gambling, the Problem Gambling Northeast Resource Center. Brandy, thank you so much for taking your time out of your day to come and talk to us about gambling and problem gambling, especially.
Thank you so much for having me. This is a great opportunity for us to get some information out there. So we really
absolutely. And before we begin, before we talk about problem gambling and everything like that, if you wouldn't mind kind of introducing yourself, sharing a little bit about yourself, where how your credentials, how long you've been in the role, maybe even some fun facts. I know we had Dr. Heidi, a pediatrician, on our first episode for childhood obesity, and she actually discussed that she played water polo in college. Now, I'm not saying you have to do anything quite like that, but if you have something, that would be really, really awesome.
Awesome. Well, great. Absolutely. So as you mentioned, my name is Brandy Richards, and I am the team leader for the Northeast Problem Gambling Resource Center. So I started my career in a neighboring county from Warren. I'm originally from Hamilton County, so the next county north from you guys. And I worked there for Hamilton County Community Services for about 15 years as a substance abuse prevention educator. So I spent a lot of time in schools and doing some outreach in the community, working with some coalitions. And then about 4 years ago, in October, a colleague of mine had reached out and talked to me about this opportunity to transition to the New York Council on Problem Gambling. I did some research on the organization, and 4 years later, I am now the team leader for the Northeast Problem Gambling Resource Center. And I have to say that it has been very eye-opening, I think, for me as somebody who had spent, a couple decades working in the prevention field. Problem gambling was nowhere on my radar. And I'm almost embarrassed to say that now. So in my new role, I want to make sure that there's people that don't miss that, especially now. So a fun fact about me. So I live near Gore Mountain Ski Center, and I am not a skier. My whole family are skiers, but I am not so much. But yeah. So that's
alrighty. Well, awesome. And I mean, that's like you said, I think for public health, especially, we're kind of in the same boat where, gambling wasn't necessarily something that we kind of thought about originally, but, especially now with the legalization of mobile sports betting in New York and the effects that it's having on communities and the way that it's being incorporated in not just day-to-day life, but also, college culture and, all these different things and different groups of people. It's gone way beyond what I think most of us really realize, and hopefully we bring some eye-opening facts to people today, and kind of discuss what is problem gambling, how does it get started, and really how do you kind of navigate the conversation of, hey, I think we kind of need to talk for a little bit.
Yes, most definitely. Those are
absolutely
all great things.
And, if you don't mind me asking, we'll start right off the bat with the first question that we have. What is problem gambling? How do you know when somebody says that I have a gambling problem? What does that really mean? And what are the effects that it can have?
Well, I think, Drew, that's a great question. I think for us, it's important to, anytime we have a conversation about gambling, we want to define what gambling is, because that can look very different to a lot of different people. So when we ask somebody, do you have a problem with gambling? The term gambling itself may mean a whole lot of different things to a lot of people. So I think, for us, we always try to work off the definition of gambling is anytime you risk something of value, and oftentimes that something of value is money, but it doesn't always have to be, on the chance of gaining some sort of reward. So that's how we define gambling. And problem gambling, this may seem very kind of like a broad definition, but we define problem gambling as anytime gambling has a negative impact on your life, whether that be financially, whether that be within your family relationships, or is it impacting your school or at home or work or some other things. So I think that's, how we define problem gambling. And then, it kind of can cross over into what we call gambling addiction or compulsive gambling. And that's, gambling addiction is a mental health condition, right? It's a diagnosable mental health condition. There's a list of criteria that need to be met for somebody to be able to be formally diagnosed with that. But, we're seeing a lot more people being impacted by problem gambling, as you mentioned, for all the obvious reasons. You're no longer just you no longer have to go to some sort of brick and mortar facility to be able to gamble, right? If we have a cell phone, which the majority of the population do, we now have access to it 24/7 right in our hands. So that has created a real significant problem for people, especially people that aren't aware of the risks that are out there. So
Yeah, absolutely. And that's a good point to bring up, the legalization of mobile sports betting. What has that kind of had an effect on for you guys? You guys are seeing this firsthand, and this is exactly in your wheelhouse. So you guys are the best people to ask about how is this affecting the communities around us. And for living in Warren County, there's a lot of things that definitely happen. It's a bigger county. There's a lot of different people that live here, and with that, we kind of want to know what populations are most affected. What is kind of the effects that you guys are seeing of this legalization of mobile sports betting?
well, I think the number one factor that we see is that increase in accessibility, right? When you increase the accessibility to something, the likelihood of problems resulting from that, kind of these unintended consequences are going to happen, and we're definitely seeing that in our resource center. We cover 15 counties on our resource center for the Northeast region, so we cover from Columbia Green up to the Canadian border, and not surprisingly, the larger populations that are impacted tend to come, a lot of our calls tend to come from the capital region and those areas that are kind of in close proximity to the local gaming facilities. But now with the addition of mobile sports betting and those expansions, we are seeing this impact a much younger demographic. And that's not to say that there aren't other populations that are more vulnerable and at risk, to developing a gambling problem. Our young adults, our youth, college students, as you mentioned, the BIPOC population, individuals that maybe have a co-occurring mental health or substance use disorder, individuals who are homeless or living at or below the poverty level, our veterans, so unfortunately, like any other addiction, problem gambling does not discriminate, and it can impact anyone at any time. But I think some of the trends that we're seeing is that, people are starting to develop a problem with gambling at a much quicker rate, and, getting themselves into financial trouble, legal trouble, and some other of those consequences at a much, more quicker rate, because again, that accessibility, right? People are not, it kind of limits, there are no limits to how much, somebody can gamble. They are not, one of the things that I think separates gambling from other addictions is that, there's no saturation point with gambling, right? You're not going to overdose on gambling. You can just continue to do so. And as long as you have access to funds and money, you're going to be able to do that. And sadly, some people resort to things like stealing or borrowing from family members or friends, or, depleting, their savings account, or taking out loans and family members or spouses' names. So that, these are all things that we see happening.
Yeah, absolutely. And I mean, it's, as you were kind of talking about, that it's the increased accessibility, and not only the increased accessibility. I know that as soon as uh, we heard that there was a legalization of mobile sports betting, it seemed like everywhere there was a DraftKings ad. There was, there was all these different ads that were going on in TV. You saw them, on your phone. You saw them in the newspapers. You saw them just about everywhere. And as you said, it's not discriminatory on the population. It'll go for whoever and wherever they are. And, if they have the ability to gamble, they have the ability to become addicted to that gambling as well.
Absolutely.
And you kind of touched upon the effects that it can have. What are some of the effects that you have seen regarding whether somebody's personal life or their financial stress? What kind of effects does a gambling addiction have on just not only their financial aspect of their life, but also on the other aspects of their life?
Well, again, it's very similar to other addictions, Drew. There are so many aspects of your life that gambling impacts. And it's not only the individual who gets impacted, it's also their family members and loved ones. One of the great things about our resource center is we can offer services not only for the affected individual, but also for the affected others, to help them kind of navigate the challenge of dealing with somebody that has a potential gambling problem or gambling addiction. So I think that those are things that are super important for us to be aware of. And, they're just, again, I want to go back to the accessibility, and you talked about the advertising piece, right? I think that one of the unique things with the mobile sports betting is it is, I saw a quote in an article not too long ago, I think it was in the New York Times, that talked about, gambling makes, betting on something makes the uninteresting interesting. And that's very true. You see all these promotions and ads, and people that maybe had no interest in sports whatsoever before are now kind of being lured in with these quote unquote, risk-free bets and all these opportunities. It's like, the rationale behind it is, I'm not using my money, it's, if somebody's going to give me $100 to do that, I'll do that, and, of course we know there's no such thing as a risk-free bet, right?
Yeah, absolutely. And like you said, it makes the uninteresting interesting. And that's a very, very big point to bring out. One of the biggest events in American sports is the Super Bowl coming up here. And with that, you can bet on just about anything. You can bet on whether it's going to be a head or a tails. You can bet on whether the team is going to kick or receive. You can bet on what color the Gatorade is going to be when they dump it. Just all of these different things. And so with that, we kind of talk about how it's accessible and it's going into all of these different populations. How have you seen it? How have you seen it kind of develop? What are kind of the stages of a gambling addiction or problem gambling? Is it just somebody goes all in? Is it a gradual thing? What kind of happens?
Well, I think it varies, obviously upon the individual, but I think the opportunity for it to develop into a problem is happening so much more rapidly now. One of the things, in terms of a warning sign that we talk about is, for somebody to be able to set limits on the amount of time and money that somebody spends. And with these mobile sports betting apps, it's very easy to lose track of the amount of time that you're spending on it. All of a sudden you're researching stats and your player, and, you're looking at the odds and you're checking the scores on these games. And, it's very easy, I'm doing a $5 bet here or a $10 bet here. And then all of a sudden those things kind of add up, and it's linked to your card. And so you're not really, able to really keep track of how much time and money is spent on that. And is it pulling you away from some of the other things that are going on in your life? Are you kind of being drawn from family and friends? Are you, checking your stats when you should be working? Or, when you're in class, are you staying up late watching these games? So I think that there's, a lot of opportunities for people to kind of fall into that. And, gambling addiction, again, like others, it kind of hijacks that same reward center in your brain, right? You get that dopamine rush. And it's not even really about the win. It's about the anticipation of that win. And you talked about like the multiple opportunities for somebody, to place a bet, you're getting those little dopamine hits, multiple times now. And so again, it's kind of that perfect storm, and I think the other thing too is we're not really talking about this, right? It's very much accepted in our society, as when we were younger, in terms of prevention stuff, I'm sure that people were talking to us about the risks of, alcohol and vaping and marijuana use and all of these other things. And gambling wasn't necessarily a part of that conversation. And it absolutely needs to be. And I think it's more important now than ever to be having those conversations as a parent, as a community member, as educators. There's so many different opportunities for us to be able to make a difference and intervene before it gets to that point where somebody is, really desperate.
Yeah, absolutely. I mean, like you said, it's definitely like I said, it's not something that public health was originally, thinking about. It's not something that a lot of people think about. It's not, like you said, it has a very common place in our society right now. And obviously things can change. With that, what are some of, in order to stop gambling addiction from spreading, it's going to take a multi-pronged approach, whether it's at an individual level, community level, or a policy level. And so with that, what do you see are the barriers? Or is it more of a policy standpoint? Is it more of something where we need to do more work at a community level? Is it something that individuals need to do more research on their own? What are some of the biggest barriers that you're finding to getting the information out there about gambling addiction and problem gambling?
Well, I think you said it perfectly, right? We need a multifaceted approach, right? We need to tackle this at all angles. We need to get ahead of this, because again, we're being bombarded with, advertisements that are being targeted towards young people. And so I think you're right. I think, there's a lot of opportunities for us to educate on, kind of at the prevention level, at the treatment level, at the recovery level, all throughout, there's an opportunity for us to be having conversations with people, whether it be at home, as parents talking to our children in the community, organizations like public health and other, folks that are serving the public. I think it's an opportunity for us to have these conversations and talk about gambling. If we're not talking about it, we're not giving permission for other people to talk about that as well. Screening is another thing that we really are trying to advocate for in terms of policy pushing. March, not surprisingly, we have the Super Bowl, coming up, and then March is March Madness. There's a big push for that, and March
Absolutely.
is Problem Gambling Awareness Month for that very reason, and that's an opportunity for us to be able to have these conversations with local organizations and community members. And I think there's just in terms of barriers, I think just a real lack of understanding that this is an issue and this is a significant issue in terms of a public health approach. One of the most alarming things for me as an educator, when I came into this role, was learning that problem gamblers have the highest rate of suicide than any of the other addictions. About 1 in 5 individuals with a gambling problem has either attempted or died by suicide. And I think that really speaks to that sense of how quickly it can get out of control for people. We call gambling addiction the hidden addiction, because there's no test, right? There's no urine test. There's no breathalyzer. I always say, as I'm doing, I do a lot of education in the communities, and we talk about how, if I were somebody that had a substance use disorder, there may be some outward signs that you might be able to notice, on me. Whereas if I just bet my paycheck before we had this conversation, you wouldn't really know that, right? I could be betting right now, say as I'm doing a training, somebody could be on their phone placing a bet right now and we wouldn't really know that, right? So, for us, it's really important to kind of shine a light on this hidden addiction and do, participate in things like this where we can kind of educate the general public and raise awareness about the fact that this is a real significant issue.
Yeah, absolutely. And as you kind of pointed out, that individuals who have gambling addictions or problem gambling, they have higher rates of suicide. And with that, I kind of wanted to ask, what are some of the mental effects of a gambling addiction? Is it, we obviously see that mental health and physical health are very much tied together. So with this, any effect on your mental health is obviously going to be affecting your physical health as well. And that's something that we're kind of just connecting the dots now about. It's not something that was very apparent early on, but now we're seeing a lot more of it. So with that, we're just kind of wondering, what are some of the mental effects that a gambling addiction can have?
Well, I think that's an important point to make. A lot of people with gambling problems, when folks reach out to us for help, oftentimes, gambling is one of the many things that are bubbling up for them. We see so many times we see co-occurring things that are going on, co-occurring mental health. We see a lot of people that who turn to gambling as an unhealthy way to cope with those mental health stressors that are going on, or, they may be using gambling as a way to cope with grief or loss or some other stressors that are going on. With COVID, so many people lost jobs and there was a lot of different, transitions. Kids were home and not in school, and that really took its toll. And I think, gambling is, again, something that's very easy to sneak up on somebody. It's a way, again, for people to do that. And we know that, one study showed that about 90% of individuals who are impacted, a lot of people other people are impacted, can have that emotional distress based on just dealing with somebody who's struggling with a gambling problem. So again, it kind of has that ripple effect.
Yeah, definitely. And obviously that ripple effect is a really, really big thing because again, it doesn't just start and stop with you. It goes outwards. It spreads to multiple people, as much as we like to assume that no, it's me, it's my problem, and it's something that I can fix. A lot of the times you're affecting more people than just yourself. And that's a very hard thing to kind of come to terms with. And so, we're kind of with that. How do you, as a family member, or maybe as somebody who's close to somebody who has a gambling addiction, how do you navigate the conversation of, listen, we need to talk about gambling. We need to talk about this addiction that you kind of have. How do we navigate that conversation? How do you start it?
Well, I think one of the things that's important is making sure that you're aware of what those warning signs are, right? Just like any other addiction, being mindful of, changes in behavior, changes in mood. And I think just having that conversation, if you're concerned about somebody, say something. A lot of the resources and print material and outreach that we do really talks about, excuse me, ways that we can have that conversation. And we have supports for those loved ones to be able to kind of navigate that and have those conversations, and don't be afraid to reach out for help. I think that that's the most important thing.
Yeah, absolutely. And
Excuse me.
as we're kind of going through this, we kind of draw similarities between gambling and substance abuse. And so with that, we're kind of wondering, how do those coincide? How do those two kind of relate to each other? I mean, we know that they're both addictive things, but are the effects kind of similar to substance abuse and gambling, or is it worse in some ways? What is it kind of, how do those two kind of coincide?
Well, I think there's a lot of similarities and in terms of the impact that it has not only on the individual, the family, the whole family kind of system. But I think there are some unique differences that make it that kind of separate it a little bit. And I think, that hidden piece, right? And that the idea that you're not going to be able to, there's no saturation point. And I think the other thing too, in terms of a barrier, I would say is that, if I'm somebody who's struggling with a gambling problem or a substance use problem, there's a lot of resources that we're aware of for mental health, for substance use. And a lot of people wouldn't necessarily know who to turn to for, if they're recognizing that, maybe I am concerned about a loved one, they may not know that there is help, that our resource centers are out there. So I think that that's a real significant barrier, for folks reaching out, which again is why it's so important that we have these conversations, that we do a good job of educating service providers and community members to be aware of, what are some of those things to look for? How do we make sure that we, can intervene at a point so it doesn't get to that point where somebody is suicidal or, in risk of losing their home or their job or their loved ones or some other real significant impact.
Yeah, absolutely. And you kind of talked about the resources. A lot of times what we find is a lot of the barriers to care are a lack of knowledge on the resources that are available to somebody. For people who want to quit smoking, for a lot of times they don't realize they have all these different resources for them. And so with that, what are some of the resources that are available for somebody with a gambling addiction, somebody who, is experiencing problem gambling? What are the resources available for them?
So I think the good news is that there are, right? That's why we exist. The fact that our organization exists shows that there is a need for this. Just to give you a little background, several years ago, there was a pilot program done down in Queens, New York, called the Queens Center of Excellence, and it really looked at addressing some of those things the very things that you mentioned. What are the barriers for folks who have gambling problems reaching out to treatment? We were seeing a very low rate of people being able to access treatment and stay engaged in that treatment. And some of those barriers were, things like transportation and folks not being their gambling addiction not really being kind of the primary focus of the treatment. And so that's how our resource centers came about. We had some great tremendous success with that problem gambling, the Queens Center of Excellence. And as a result of that, these resource centers all throughout state were developed, and we were provided funding through the Office of Addiction Supports and Services to be able to provide these resource centers. So we are one of 7 resource centers across New York State. So the good news is anywhere that you live in New York State, there is a problem gambling resource center available. And our goals of the resource center are very simple. We have 2 goals. One is to just raise awareness about the issue issue of problem gambling, and the second is to connect people to care. And that's what we do. Oftentimes we kind of look at these resource centers as kind of the problem gambling hubs, right? And anything problem gambling. So any kind of outreach or materials that you need to be able to educate the public, but also how can we meet people where they're at? Our motto at the Resource Center is no barriers to care. And so the whole success of our program really hinges on the fact that we have eliminated all of those barriers. And one of the real significant barriers, not surprisingly, to somebody who has a gambling addiction, cost may be a real significant impact or a barrier for somebody reaching out for help. And so our funding allows us to be able to offset the cost of treatment, not only for the individual themselves, but also for family members who are impacted. So the same supports and services that we offer to the individual, we can also offer to the family member. And we recognize that there's a lot of different pathways to recovery. So it's not just a one-stop shop. So it's our job to be able to know what those resources are and services. And so we get folks connected to those. So whether it be, we have our own network of licensed problem gambling treatment specialists. So these are mental health professionals who have specialized training to deal with somebody who has a gambling problem. So we have a network of those folks that we can set up for one-on-one counseling. We have a variety of peer supports. We recognize the importance of talking with somebody with a lived experience, somebody who's been there. So maybe somebody's not quite ready to engage in treatment right away. So we can get them connected with a peer in recovery to help them kind of, make the steps to be ready to maybe make that next step for treatment. Believe it or not, there are inpatient treatment options, for folks who maybe have co-occurring substance use and problem gambling or mental health disorders. So we can get folks connected to some of those OASIS funded treatment facilities. We have, again, connections with the recovery community. So whether it be Smart Recovery or Gamblers Anonymous or Gam-Anon for family members. So there's just a whole host of services that we can help you get connected to.
Absolutely. And that's obviously very important. It's always what we found when discussing substance abuse and managing addictions, the biggest thing was never really feeling like you were defined by the addiction itself, but rather that the addiction was something that you are currently struggling with, and it is not you yourself, it is something that you are working on getting past. And I think that is always a very hard thing to kind of balance, but obviously you guys are doing very, very well. And with the more resources that you guys are hopefully going to have, and hopefully currently do, the amount of resources that you guys currently do have, it's always nice to kind of go in and be like, there's always something else that I could be doing. There's always more that there can be done for me. And that's always a very, very big thing. But, as we kind of wrap up our discussion about problem gambling and gambling addictions, is there anything that you would like to add? Anything that we didn't quite get to that you were like, absolutely, please let me do this?
Sure. I'd love to be able to, get our information out about our resource centers and how to connect with them. So if we have a website, it is nyproblemgamblinghelp.org. And if you go to that website, there will be a beautiful interactive map of New York State, and you can click on the region that you are connected with, and it will get you connected to your local problem gambling resource center. So our resource centers currently are we operate Monday through Friday from 9 a.m. to 5 p.m. We are in the works of hopefully, expanding those services, because we recognize that, folks are reaching out for help, not just during those traditional hours. So we want to be able to really meet people where they're at. And I think, again, as we talked about with all the expansion, it's so important that we continue to receive funding to be able to continue to expand, to keep up with the demand and need for these services, because it is ever increasing.
Yeah, absolutely. And gambling it's something that definitely does need to be addressed. It's a very hard conversation to have, because again, the data is kind of hard to get. You can't really find data on what effects gambling can have, because again, it's a lot of your mental state. It's a lot of sure, you can look at the finances and things along those lines, but it's again very hard to kind of like diagnose. It's not something that you're like like we said, you take a test and boom, we know what it is. It's very hard to kind of navigate that and really decide on where the issue kind of lies.
Yeah, well, the good news is that there are some screening tools that are out there. So again, we encourage organizations to do that. And I mentioned earlier that March is Problem Gambling Awareness Month. Another great opportunity to learn more about, who we are and what we do, and to kind of talk about those very things that you just mentioned. We have a conference coming up. Our annual conference is in March this year, March 8th and 9th at the Albany Marriott. Our parent organization, the New York Council on Problem Gambling, hosts this conference every year, and it's really for anyone. If you're somebody in the prevention field, the treatment field, the recovery field, just general, just the general audience, we'd love to have folks join us and learn more about, ways to address this, because it really is something that addresses, that impacts the entire community. So
Absolutely. And, obviously, I want to thank you so much for taking time out of your day to come on to us. I know you guys are rather busy, especially the start of the new year and, everything going on right now. So, thank you so much for, coming on to our podcast here. It's been an absolute pleasure to talk to you. It's been really eye-opening as well to understand that this is a much bigger problem than we kind of realized. And not only that, but it's tied into so many other facets of health that we never really kind of thought about.
Absolutely. Thank you so much for the opportunity to have this conversation, and I hope we can continue to do that and make strides to help folks who need it.
Absolutely. I'm your host, Drew Crawford, here with Brandy Richards, the team lead at the Northeast Problem Gambling Resource Center. Thank you guys so much. This was the Just for the Health of It podcast. Thank you for listening. Be safe, be healthy, and we'll see you all next time.